to those listening to Freedom of Speech here. And this time I want to talk about healthcare. Now, I haven't taken the time to read through the entire Republican healthcare proposal, but I will get around. But I'm gonna get to it. But the thing I want to talk about here is the true pointless endeavor it is to try to augment the American healthcare system. The system is for profit, whether it's insurance industries or hospitals themselves. They exist to make money, not to help people. So the ability to try to regulate them doesn't really apply because every individual is limited by where they live. So they don't really have like a myriad of different choices because a lot of healthcare regions are healthcare systems are inherently regional. There's only a handful that USA covers the entire country. So when you so regulating the industry becomes, like I said before, a pretty foolish endeavor. But they tried anyway. They tried it with Obamacare, and Obamacare had its flaws, otherwise known as the Affordable Care Act, which is actually called, and the Republican Care or the Trump Care, whichever they're going to call it. I forget the actual title of what it's called. Will fail similarly, and this comes down to that simple fact of it's for profit. People know the healthcare industry is for profit, but politicians try to pretend like it's not. And for some apparent reason, I don't think people believe what they're saying. I think it's just more along the lines of my team versus your team, and I would rather my team screw me over than yours. Because that's pretty much what we're going to get. And that's what we're going to keep getting. Because as long as the system is for profit, the only way to bring down medical costs is to share the pain. You're going to have to make people who don't want specific things, they're going to have to buy them. Or they're going to have to buy things that they're never going to use. That's the only way to break down costs. Because everything is for profit. These concepts are not difficult to grasp. They're not complicated to the point where average people can't put two and two together. But when you look at what's happening, whether it's the Democrats doing it or the Republicans doing it, you get the same effect. It's my team, yay, your team, boo. Now, I can't say that, yay, healthcare industries try to set this up, so great tactics. No, they don't have to do these things. But at the same time, it's pretty much what happens. It's neither side does what's necessary, but both sides make sure that the people who cut them checks for their elections is always made whole and good. And what I mean by what is necessary, in America, a majority of people are on either a social safety net program or they get their health insurance through work, which means a giant chunk of the American public are not in any healthcare system. They are removed from it. So when you hear people talk about regulating the system and all that other fun stuff, they're not really affecting that many people. They're not really getting to the bulk of the country, which stands to reason that if you really want to bring down costs and you want to be able to augment and manipulate the for-profit system, you need to decouple healthcare from work. Therefore, put in thousands and millions of more people into the system. But at the same time, you may have people who don't make that much money, so that even when you decouple the work aspect from their health care, they don't make enough money to really get a good plan that can sustain them or their family. Well, this is where the social safety net part comes into play. This is why during the ACA debate, aka Obamacare, you had lots of liberals saying there should be, at the very least, a Medicaid buy-in or Medicare, mostly Medicaid buy-in, where people who are on a lower spectrum, where you won't be able to get a decent healthcare package, could buy into the Medicaid program. Pretty much the same way you would, because you already got taxes being taken out for it anyway. You just increase your rate of tax removal from your check, and then you would just be able to use the system. But this also comes with a side note of you have to make the Medicaid or and Medicare systems in general more efficient. More efficient in the terms of people who are on these systems, because there will be millions more people on these systems who want to use them. You need to make it so that these doctors and providers can get paid rapidly. I mean, within a few days, because the quicker and easier they can get paid, the more inclined they will be to take these new patients. But that means that will cost the federal government some money, and we don't want to do that. And decoupling and work from healthcare means like that might help too many people out. When I mean by people, I mean businesses, because corporations are people in our country. Yeah, that would help too many. That would help too many of them out. So neither policies that were proposed or plans that were thrown out there have even thought to touch these areas. It's usually the same thing. It's we're going to bring down costs by pretty much messing with the people who are stuck in a position where they don't have any other options. We're not going to mess with the Medicare and Medicaid people, except for the overall policies having money or not, which doesn't really make a difference either way, because unless they cut the damn thing in half, it's not going to really have much impact. Shave off 10% here, shave off 20% there. Over time, nobody's going to notice. Or, mess around with people at work, because all the company's going to do is they're going to pick the cheapest one for them. And the employees will either take what they get from them or say no thank you and go somewhere else. And then hopefully they can afford the a decent plan. But let me conclude with this. The one thing I do remember about the Affordable Care Act, or Obamacare, however you want to say it, thing the Republicans will always talk about was how the Democrats didn't know what was in the bill. They passed it because it had their label on it. And what do you see from Republicans? Most of them who voted for it don't know what's in the bill. They passed it because it had their label on it. This right here is one of the reasons why I've always said that there's no difference on either side. There's no difference whatsoever. Because, I mean, they don't even have the ability to not be hypocritical. You complain about people not the passing things, not know what's in it, and then you do the exact same thing as long as it has your label on it. These individuals are entire job is to pass legislation. I guess we should have put the clause in there. Read it first. This was the freest of speech. Thanks for listening.